Today we have Dr. Anthony Holden, a cardiothoracic surgeon at Atrium Health Navicent. Thank you so much for being here today.
Thank you for having me.
I'm excited to have you here because there's a new technology you guys are using at Atrium. What is it and what does it do?
So it's a really neat technology. It's a robotic-driven navigational bronchoscopy system for lung biopsy. And in simple terms, it helps us find the tumor, and we can biopsy it at a much smaller size and earlier stage for lung cancer.
Wow. And so talk to me about this. How long have you guys been using it? How long has this been in the works? And what are your goals with it?
So we've had it now a little over 5 months. We've done close to 75 cases in that short period of time. Wow. The goal is to identify a nodule and have it diagnosed within a couple of weeks and resected and therapy started within a month.
Wow.
So if you think about it, in the old days, our parents were told they have a spot on their lung, and all of their friends had spots on their lungs because of smoking, and they became ill and didn't do well. In the old days, you couldn't find out what you had until it was too late. Nowadays, what we can do is biopsy these lesions, and we're biopsying lesions less than a centimeter in diameter without any lymph node involvement, getting a diagnosis of cancer, doing a surgical resection for those people, and sampling their lymph nodes and finding that they're early stage 1 cancer and they're cured. So it's great.
Wow, so this really is expediting the process even more. Now, why is it so important to you that you're able to detect earlier, and why is it so important that you guys are detecting this earlier?
So for lung cancer, your outcomes are dependent on lymph node involvement.
Okay.
So it makes sense. The earlier, the smaller cancer probably hasn't spread to your lymph nodes. We still sample lymph nodes, and we look at their pathological evaluation to make certain that it hasn't spread. But the smaller, the earlier cancer, less likely to have spread.
Okay. And so why is it so important to you? This is something you're really passionate about. What does it mean to you knowing that you can help your patients even faster and detect this and start treatment faster? Why is that so important to you? What does it mean?
Well, it's important to me on a bunch of different levels. From a professional level, it's wonderful because you're taking people who in the old days would they wouldn't be diagnosed until they had spread, and then they just wouldn't live as long. So it's wonderful that we're finding these early cancers, and we identify those many times through a screening process that we do. So we have a pulmonary nodule screening program, and if you fit the criteria, if you smoked greater than 20 years and a certain age range, then we would do a CAT scan on you. We'll find these nodules, and then what do you do with them? You watch them to grow, or we biopsy them. And so we're able to get an accurate biopsy in well over 90% of the patients with a single exam. And now you've got a small lesion, no lymph nodes. You're able to do a resection and cure these people of lung cancer, which in the past was a death sentence.
Wow, this is incredible. Now, this early detection technology that is available to help out with lung cancer, we'll have more information on our website, 41nbc.com. Thank you for being here today.
Thanks for having me.